I encountered a patient who had Parkinson's disease, and they had a DBS device. At that time, I was working in Saudi Arabia and had come overseas here to observe how things go here. And so I saw that person with Parkinson's disease with the device for the first time in my life. And that's how that was my first interaction with that device that apparently changed that person's life. In movement disorders, of course, I see patients with Parkinson's disease, with dystonia, with tremor, with ataxia. But recently, I've sort of further evolved into seeing patients with Parkinson-like disorders. If somebody's coming to see me, expect a detailed history. So because that forms 80% or more of my impression of what's going on. Because to me, what the brain looks like or the imaging is less important than what you tell me what is going on a daily basis. How it started, when it started, how it evolved, what symptoms are happening, how severe they are, how are they affecting their walking, their gait, their speech, all those faculties. I tell my patients, I know about the disease, I know about the medical and the medication and stuff, but you're the boss. Okay, it's sort of a shared decision. It's important to understand for the team, for the caregiver, the patient, and myself that the medications are symptomatic, most of them, and if that's the case, then we have to wait for the symptoms to become bothersome enough, and that is when you start taking the medication. I'm sort of meeting so many people in just one day, and they pour their hearts out. What are their fears? What are their concerns? And what they help with. And I feel blessed being a part of their lives, even for that half an hour or 1 hour.